The Association of Community Cancer Centers, or ACCC, represents 20,000 multidisciplinary cancer care providers nationwide. ACCC understands that its member programs sometimes face challenges when treating patients with less common cancers. To help, ACCC has identified community resource centers for a wide range of less common cancers, including chronic myeloid leukemia, acute promyelocytic leukemia, multiple myeloma, pancreatic cancer, gastric Junction cancers, and myelofibrosis.
Community resource centers were introduced in an effort to help the ACCC members have someone that they can turn to in a situation where they're dealing with a cancer that they're not frequently seeing in their clinic. It gives them an expert that they can speak to for advice on the latest clinical trials or treatment options that are going on.
Multiple myeloma is an incurable disease, so long-term disease control is the most important part of treatment. But what happens when your patient can no longer pay for maintenance therapy? How do you identify financial resources to help? One option is to reach out to an ACCC Community Resource Center.
We all have the same shared goal. Whether you're a physician, a nurse, a social worker, a navigator, we all have this shared common goal of treating cancers aggressively and effectively while maintaining this patient-centered approach. So having the opportunity to consult and collaborate with agencies around the country, experts in the field, regarding areas where you're stuck. What are the new treatment options? What's on the cutting edge of research? What are some financial assistance options for patients? Not only allows us to strengthen our practice and our agency's practices, but helps our patients overall.
For example, the Gastric Cancer Registry collects data from patients with gastric cancer, including lifestyle, health and family histories, and environmental factors, as well as blood and tissue samples of the tumors. This information is helping researchers identify molecular complexities and factors that may predispose people to gastric cancer.
If you're a physician at a community cancer center and you have a patient that has a rare disease, as an ACCC member you can call them directly. You can expect to have a person respond to you, either if they don't have the expertise to answer your question, they will direct you to that group.
About 20% of pancreatic cancer patients are candidates for Whipple surgery. But how do you know if your patient is a candidate? And because this procedure is a difficult and demanding operation, you will likely have to refer your patient to another program for this complex surgery. ACCC's Community Resource Centers can offer support and education when patients return to you for their follow-up care.
So a member of ACCC who has never dealt with a pancreatic cancer patient would have the opportunity to reach out to a community resource center such as Winship Cancer Institute and speak with one of our providers about the latest treatment modalities, how to help that patient, and maybe establish care at another facility or help them with the new treatment plan in their own facility.
So it's really easy to contact the community resource centers. If you go on the ACCC website, there'll be information listed for all of the resource centers and an email there that you can contact to get in touch with the resource center that you need.